Welcome to Smart Stuff. Today we're diving deep into a condition that can be incredibly stealthy, but have some really severe consequences. Pelvic Inflammatory Disease, or PID. We're going to break down what it is, what causes it, and most importantly, how to deal with it before it causes any lasting damage. Let's get right into it.
So here's our game plan. First, we'll cover the basics of what PID actually is. Then, we'll look at the causes and who's most at risk. After that, we'll talk about symptoms, diagnosis, and treatment. And we'll wrap up with the really crucial stuff, complications, and how to prevent them.
All right, let's jump into our first section. So what exactly is pelvic inflammatory disease?
The most important word on this slide, the one you really need to remember, is ascending. This isn't just a simple localized infection. Think of it more like an invasion, where bacteria start a journey, traveling upward from the lower genital tract into the upper reproductive organs.
And this diagram right here, it perfectly illustrates that journey we're talking about. You see, the infection usually kicks off in the lower tract, that's the vagina and cervix. But then it climbs past that dotted line into the upper tract, and that's where it can affect the uterus, fallopian tubes, and ovaries.
So PID is really just a catch-all term. Depending on where that infection decides to set up shop, it gets a more specific technical name. If it's in the uterine lining, bam, it's endometritis. If it's in the fallopian tubes, it's salpingitis. This just shows how far and wide the inflammation can actually spread.
Okay, so let's build on that. What kicks off this infection in the first place? And what kinds of things put a person at a higher risk for developing it?
So this list lays out the big risk factors. It's a mix of behaviors, your medical history, and even your age. Now, some of these might seem pretty obvious, like having multiple partners or a history of STIs, but others are less intuitive. For instance, douching can actually mess with the vagina's natural balance of good bacteria, basically rolling out the red carpet for harmful bacteria to thrive and start their climb.
And here are the main culprits, the bacteria behind the trouble. The two big ones are the bacteria that cause gonorrhea and chlamydia. And get this, chlamydia was the single most common cause of PID. But as you can see, it's not always them. Other bacteria can definitely play a part, sometimes in very specific situations.
Okay, so we know what causes it. But how does this infection actually play out? And maybe more importantly, what are the red flags you should be looking for?
This breaks it down into a pretty simple three-step process. Step 1, it all starts at the cervix, usually with the chlamydia or gonorrhea infection. Step 2, the infection starts that upward climb into the uterus and beyond. And then step 3, which is pretty interesting, is that other bacteria can act like accomplices, kind of helping that main infection to spread and get worse.
Now, knowing the symptoms is absolutely vital. The most common one is a kind of dull ache or pain in the lower abdomen, but this list shows a whole range of other warning signs. We're talking pain during sex, pain when you urinate, fever, unusual discharge, and weird bleeding. Any of these are major signs that you need to see a doctor, like right away.
So when you go to the doctor, they're looking for very specific clues. During a pelvic exam, they'll check for something called cervical motion tenderness, basically pain when the cervix is moved. They'll also feel for tenderness around the ovaries and fallopian tubes. These are huge clinical signs that point straight to PID.
All right, on to the next critical step. How is PID officially diagnosed, and what's the plan of attack for treatment?
So believe it or not, for a doctor to even start suspecting PID, they often just need to find these three key things during an exam. If a patient has that lower abdominal pain, plus the cervical motion tenderness and the adnexal tenderness we just talked about, well, that's a very, very strong indicator that PID is the culprit.
But to really nail the diagnosis, doctors look for these additional clues. It's kind of like detective work. Things like a fever, a high white blood cell count, or signs of inflammation in the blood all add more evidence. And of course, a positive lab test for chlamydia or gonorrhea, that's pretty much the smoking gun.
Treatment almost always involves antibiotics. This table does a great job of showing how the plan changes based on how severe the infection is. For milder cases, treatment can be done at home, usually starting with an injection and then a couple of weeks of pills. But for more serious infections, a hospital stay is necessary to get those antibiotics directly through an IV.
So who actually needs to be admitted to the hospital? This list lays out the clear reasons. It's usually for the more complicated or severe cases. For example, if a doctor suspects an abscess, if the patient is pregnant, or if the infection is really bad. Being in the hospital is essential for more aggressive treatment and constant monitoring.
Okay, this point is so important, I can't stress it enough. PID is often caused by STIs. That means the patient's partner is probably infected too, even if they have zero symptoms. If you only treat the patient, you're just setting everything up for a cycle of reinfection. The partner has to get treated, period.
And that brings us to what is probably the most serious part of this whole discussion, the long-term damage from PID, and, most importantly, how to stop it from happening in the first place.
The damage from PID can be severe, and it can be permanent. All that inflammation can cause scarring in the reproductive organs, and that scarring can lead to chronic pain, major difficulties getting pregnant, and a much, much higher risk of an ectopic pregnancy, which is a life-threatening medical emergency.
And this slide just drives that point home so powerfully. On the right, you see the clean little diagram of what hydrosalpinx is, a blocked, fluid-filled fallopian tube. But on the left, that's what it actually looks like inside someone's body. That swelling, that scarring, that's the real-world damage that can lead to infertility.
And then there's this. It's a much rarer complication, but it's just wild. It's called Fitzhugh-Curtis syndrome. The inflammation can travel all the way up to the liver and cause these fibrous bands, these adhesions to form. They call them violin string adhesions because of how they look, and they can cause some serious pain.
After seeing all those potential complications, prevention is obviously the name of the game. And thankfully, it really boils down to practicing safer sex. The ABCs are a super simple way to remember it. Abstinence is the only way that's 100% effective, but for anyone who is sexually active, being faithful to an uninfected partner and consistent condom use are the keys to cutting down that risk.
So let's end on this time. We know PID is treatable, especially when it's caught early, but the stigma that still surrounds STIs can stop people from getting the help they need, which allows all that permanent damage to happen. So the question for all of us is, how do we use this knowledge to spark open conversations, encourage regular screening, and push for quick action for our own health and the health of our partners?